Starting. All attendees are in listen-only mode.
Hello, you all. Thank you for attending the Tennessee Justice Center's SNAP webinar series. I myself am Cassandra Lockridge. I am the SNAP Access Coordinator for the Tennessee Justice Center, and I'm representing our nutrition team. And you have now taken part of our SNAP webinar series entitled Addressing Hunger and Health in Tennessee with SNAP. And don't let SNAP just be too specific, because SNAP really ties into so many things, as you will see from today's presentation. So what we do specifically at the Tennessee Justice Center is for about 22 going on 22 years, we have been cutting through red tape, i.e. Trying to help our clients access, again, basic necessities in life. But of course, it relates to healthcare and nutrition. Like I noted before, I represent the nutrition work, but we're doing healthcare work also, and we do it through 3 different areas. We do it through individual casework, so helping people individually with any hiccups they may have. We deal with training and technical assistance. So we offer, again, this is a way of us giving individuals information about programs, about information, technical things that it may not be common knowledge, and we're here to support and help individuals in that area. And then we advocate and do advocacy work in the areas of healthcare and nutrition as it pertains to different programs in the state. Like I noted before, I am representative of the nutrition work. And essentially what our mission is in our work is to make sure that every Tennessean has access to the food that they need to lead healthy and productive lives. So I represent the SNAP work as the SNAP Access Coordinator. And essentially what I am doing is to work with multiple organizations, schools, food banks, religious organizations, and advocacy partners to protect the nutritional programs that are in our state happen and let them stay the way they are, or improve in the ways that they could. We believe that every Tennessean should have access to food, and we see it through different programs that this could be achieved, i.e. through SNAP, as it reaches all different populations in the United States and Tennessee. School meals as it pertains to our children and families, and children getting access to the food and nutritional needs they have. And then summer meal programs, as in for the summer times when, again, our schools are out of session, and other programs that come in to help our children, our families, and our adults, again, lead productive and healthy lives with food access. It would do me justice to talk about the 2 presenters that we have on our call today, i.e. Bringing up the reason why some of you all may wanted to participate on this call. Again, just want to note we do have a diverse amount of attendees on it, so I do applaud anybody who have registered and is attending this call today and this webinar today, because again, we're going to learn a lot of different information about different partners. And I had the opportunity to talk about what this UT Extension does with their family and consumer sciences programs. So we'll have Janie Burnley, who is a professor and a state extension specialist for nutrition and food safety within UT Extension's Family and Consumer Sciences Department. And essentially, the specialists work with family consumer science agents in 95 counties, all the counties, y'all, in Tennessee, to implement educational programs in the community. So they are traditionally known for their workshops and demonstrations, as well as their extension publications, but they do work with community partners, different organizations to create a healthier community, as we see into Tennessee and with their work. I also want to introduce the AARP Foundation, which we have Amy Cohn, field program manager for Tennessee, going to speak about the programming and the things that the AARP Foundation is doing for, again, trying to have a country free of poverty where no older person feels vulnerable. Again, their mission is to serve vulnerable people 50 or older, and again, trying to work to implement effective solutions that help the older adults and people access the things that they need to get themselves out of poverty. The AARP Foundation is a charitable affiliate of AARP, so they serve AARP members and non-members alike. So the agenda for today's webinar is as such. We're going to explain kind of what the hunger landscape is in Tennessee, to allude to some data, to just explain to why most of us are doing the work that we're doing, where we're presenting on this webinar, and what we have to solve. I'll explain some federal programs that address hunger and health in Tennessee, some agencies that deal with those programs, and how we've been doing it on a state level. Then I'll explain to you some things that relate to SNAP, and as SNAP feeds into the other programs, i.e. University of Tennessee's SNAP education programs, the AARP Foundation's programming and programs, and then touching it down to you about what you can do in your role to address hunger and health in Tennessee. So you all, we do have a problem. Over about, so I want to say about 967,430 Tennesseans, according to Feeding America, which is the umbrella organization for all the food banks in Tennessee and across the United States, are unsure where their next meal will come from. For your information, the overall rate for food insecure in Tennessee is 14.5, and just to bring back to layman's term what food insecure means, is a term that's deemed by the United States Department of Agriculture, and it's a way to measure how a family sometimes runs out of money to buy food, or sometimes runs out of money to buy the food as is because they don't have any more money. And just to give a mindset of how much an average meal costs in Tennessee, according to Feeding America, it is $3. Again, as we touch back down to our families and children, 1 in every 4 child in Tennessee is food insecure, and as I explained what food insecure means, again, they're faced with the risk of hunger every day. And just alluding to the map, most of the state is above national average, with only about 4 counties out of 95 counties below national average, which shows that we still have some work to do. Also, 16% of adults, according to the National Foundation to End Hunger, and this is their State of Senior Hunger report, 60% of adults faced the threat of hunger in Tennessee in the past 12 months in 2018, as you can see from the far right of the image. And then we can compare it to the U.S. average, which is where the circle is at for the United States, is around 14.3, maybe 2, if you kind of push it a little bit down. But according to the Food and Research Action Center, the food insecure rate for seniors, which the Food and Research Action Center deems seniors as 60 plus, in between the average years of 2014 and 2016, they deem that rate to be 10.4, with 4.9, again, seniors being deemed as very low food insecure, as you can think of it as chronically food insecure or at risk of hunger. Of course, there are different behaviors and actions that happen when people are faced with, the risk of hunger and trying to figure out where their next meal will come from. Families and older adults, forego healthier measures and purchase, less healthier items due to a limited budget, and other non-healthy items being more sometimes cheaper than more healthier items. Trade-offs are being made between medicine and food, again, to make it day by day and to make things stretch. As some people remember the media highlighting some aspects of individuals cutting their pills, again, to make sure that they can have more medicine for them to last through the whole week. Again, adults tend to forego their own personal needs to meet the needs of their children. Their preventive care measures for the adults are sometimes neglected, again, which have, again, bad long-term effects for the adult's futures, which we can see in exacerbate diseases, compromised health, increased physician encounters, increased ER visits, increased hospitalizations, and in an increased expenditure for prescriptions and medications. Also, just to note, the Robert Wood Johnson Foundation has been doing some phenomenal work on addressing social determinants of health. And just to allude to the image to my far right, there are social determinants of health. And if you would like more information about it, again, I want to note you to go into Robert Wood Johnson Foundation's work on social determinants of health. But again, these are the non-medical factors that, again, include health-related knowledge, the attitudes, going back to the behaviors, the beliefs that have an upstream factor for people to, have different determinants and poor health outcomes. There's different factors like social disadvantages in society, risk exposures to different circumstances and situations. There's social inequities, and that all play a role in poor health outcomes for our community in the places where we live, work, and play. And also, just to bring up ACEs, ACEs being a new phenomenon up in dealing with social determinants of health, just as much as ACEs have a play to part with social determinants of health, so does lack of access to healthy foods. Because if you don't know where your next meal will come from, you are constantly thinking about it, constantly stressing, and constantly your stomach is telling you to eat, but you don't know how to address it. So again, all these different aspects of hunger tie into the person, and we're just trying to find ways to get them to the food help that they need to, again, persevere through another day. But I have great news, you all. Great news. We have solutions. We have programs. And this is where I'm going to talk about, and this is where we go very happy and very optimistic, because we do have programs that address hunger and health in Tennessee. And we have the list in the next slide, and I want you all to just think about it. We have programs here to address it, about how much we may talk about it, think about it. If we see them all on the list, we have some options to work with. So the United States Department of Agriculture, which is, again, the federal entity that really deals a lot with trying to address nutrition and, again, address hunger in Tennessee. So all the following programs with their acronyms, we can say the acronyms all day. Now we see what the acronyms mean. We see what the program is. And I'm just going to allude to you what the program is. Just a basis, most people already know, but the basis of it, and then kind of tell you who's the state agency that deals with the program, just so you all will know. So there is the Commodity Supplemental Food Program, which is kind of the commodity boxes that are given to elderly individuals over the age of 60. And this program is done with the Department of Health, Tennessee's Department of Health, within the Nutrition and Wellness Department. Then you have the Child and Adult Care Program, which is essentially an after-school program, which is administered through the Department of Human Services. Going to number 3, National School Lunch Program, which we all know with dealing with different school systems, that is ran by the Department of Education. Going to number 5, that is ran by the Department of Education. Number 6, that is ran by the Department of Human Services. Also, number 7 is ran by the Department of Human Services. My regard is Department of Education for number 5. Number 7 is the Department of Education. Number 8 is the Department of Human Services. Number 9 is the Department of Human Services. Number 10 is the Department of Health. Number 11 has to do with different various farmers markets in Tennessee, so it's kind of more complicated. I can't give you a straight answer, but I can give you a resource at the end to let you figure out what entities deal with that program, but it's mostly farmers markets. And then we have 12, to not neglect the overall Tennessee Nutrition and Consumer Education Program, which is, again, going all the way up to USDA, and that it's a specific program, but it's not just, something that everyone may know of. Just to give more emphasis on how SNAP is improving health with individual participants and families and households on the program, SNAP is improving the health of adults and seniors by, again, like I noted before, the cost-related medication non-adherence. So individuals have more leeway, more food purchasing power to be able to buy the food that they need and still be able to buy the medication they need. Healthcare spending, again, may not be as much, or it may be able to be addressed because, again, people have more opportunities to deal with food and be able to buy the nutritional foods they need. And just, again, also depression risk is reduced. The hospital admission and costs are reduced. And like I said, bringing up a lighter and more optimistic part, that we have SNAP to address health, but we had a problem, but now we have a program to fix it. Also, just to know some more how SNAP addresses hunger and health, about 543,000 households, you all, in Tennessee participate in SNAP. That means, and that means SNAP reaches over 1 million Tennessee residents. So even though we have food insecure, individuals and people who are at risk of hunger, SNAP is here to reach the populations that we can't do with, again, our pantries and other places that help with food assistance. And 95% of individuals in 2015 were reached by SNAP. SNAP also helps families put food on the table. It helps reduce the food insecurity and again the stress that goes with that. SNAP benefits have shown to reduce food insecurity among high-risk children by 20% and improve their health by 35%. Again, SNAP benefits over the summer, again, with the clash and the help with the school breakfast program and a national school lunch program, we're again able to cut the very low insecurity children by nearly 1/3. Again, we're improving health outcomes because, again, children with access to SNAP are less likely to have stunted growth in their adult life. And then we have participation. Solely being a SNAP participant opens you up to so many different programs that can address your health concerns and give you access to fresh fruits and veggies. So Medicaid, or the program here in Tennessee, is TennCare. If you're a SNAP participant, some programs that you may be eligible for could be TennCare. And also different programs like Medicare savings programs, different programs just based off of the income and the brackets that SNAP and other programs address. Again, programs solely have participation that allows clients to get more access. But without further ado, I would again have the opportunity to allude to another program that, again, a lot of people would like to know more about, that deals with SNAP education and how SNAP participation specifically addresses these concerns. So without further ado, I'm going to have Jane Burney from UT Extension, who is, again, a extension nutrition specialist with, again, UT Extension. And again, I give the acronym and alluding it to SNAP education just in case people know the acronyms more faithfully than the name itself. So again, without further ado, I would give Janie Burney the opportunity to speak to you all about her program with SNAP education.
Okay, thank you, Cassandra. Thank you all for being here with us this afternoon. I'm happy to share what we're doing at UT Extension in our SNAP Ed program. So SNAP Ed is, next slide, please. SNAP Ed is one of the many programs that we do here at UT Extension. And in the past, you may have heard of a program called TNCEP, TNCEP, and that stands for Tennessee Nutrition and Consumer Education Program. That is actually UT Extension's SNAP Ed program. What Extension contracts with the Tennessee Department of Human Services to provide statewide SNAP nutrition education. And this includes not only the University of Tennessee in Knoxville, but also Tennessee State University Cooperative System. So we work together cooperatively to do SNAP education. This program is coalition driven, and it's designed to help low-income individuals and families reduce health risks associated with poor nutrition by gaining knowledge and skills needed to effectively use SNAP benefits and related resources. Next slide, please. I would like to share with you how University of Tennessee Extension is delivering education in communities throughout the state and some of our impacts. In 2017, We reached over 28,000 individuals and families through direct education, such as workshops and classes. And we reached over 143,000 through community interventions designed to help make healthier choices be easier. And then we also delivered 132,000 contacts through social marketing. So, for example, we work with schools to provide teachers and cafeterias with information and other resources they can share with students. We work with child care providers, senior centers, work sites, faith-based communities, and other places where families learn, work, and live. So that's kind of in a nutshell last year what our outreach looked like. Next slide, please. But we can't do this without our partners, and that's where all of you all come in. We love to work with partners. We feel like we can do so much better job when working with other agencies or organizations. We just can't accomplish all we need to do without partners. So in 2017, we had over 1,000 community partners that were actively involved in 85 10-step coalitions across the state, or SNAP-Ed. The purpose of these coalitions is to bring together members of the community to assess the needs of the community, develop community education programs that address those needs, and determine how best to use the funds provided by Tennessee Department of Human Services to reach their goals. So, for example, a coalition might decide to place learning centers in public libraries with books and resources on choosing a healthy diet or increasing physical activity. It may decide to implement cooking classes to teach families how to prepare healthy foods. Next slide, please. These are some of our impacts. In 2017, 30% of our participants reported that they increased their fruit and vegetable consumption. That's a really big push for us. We really focus a lot on fruit and vegetable consumption. 26% increased their physical activity. And we also work a lot in food resource management behaviors. 41% improved their behaviors in 2017 by budgeting and better shopping skills, making use of resources like SNAP to reduce hunger and consume a healthier diet. And then we also implemented a policy, systems, and environmental changes in 393 sites. And that's our community programming, where we really do work with other partners to help change the environment that our citizens are in, to make it easier for them to make healthy choices. Next slide, please. I just pulled a couple of comments from some of our participants, and this one is in Hawkins County. And this participant said, I exercise at the senior center, about 5 hours per week. I had thought I would cut back on that, but since this class, I realized how very important that exercise is. Next slide, please. And this is another one from Warren County. The recipes I've learned are a major blessing for me. I can help my family eat healthier, and the information books are great. Thank you so much for everything this class has taught me. So next slide, please. Through a collection of ready-made resources, we have a program called Easy Choices. And this is a program that helps our agents work with community partners to implement some of these policy, systems, and environmental changes at sites that low-income individuals frequent. Now, this could be a lot of different things. It could be encouraging churches to install water fountains, encouraging schools to put up information about healthy eating in the cafeterias. It's just a lot of healthy vending machine practices, all kinds of different things, depending on what the community or the organization needs. So extension agents, they work to facilitate the change process while the site partners implement and sustain the changes. Next slide, please. And one of the programs that I've worked on a lot is called Farmers Market Fresh. And this program promotes farmers markets as a source of fresh fruits and vegetables. And in 2017, we used an interactive social marketing campaign that we implemented in 40 farmers markets in the state. And these are in census tracts where there are a lot of SNAP recipients, and in markets where SNAP benefits are provided. So we had in 2017, we had over 48,000 direct contacts with consumers through this program, and we made over 220 food demonstrations. And what we found is it did increase the purchase and consumption of locally grown produce. The picture on the slide is just an example of one of the recipes that we do. We give each week that we do this in the summer months, we give a recipe out for everything that we've demonstrated. Next slide, please. Another program that we have is called Learn, Grow, Eat, and Go. And this is a 10-week curriculum, basically, where students learn more about gardening, healthy eating, and physical activity. And this interdisciplinary program combines academic achievement and gardening, food experiences, physical activity, and school and family engagement to promote healthy eating and active living. And you can see one of the recipes that we do. We do a whole, as you know, Extension does a lot of recipes, and if you don't know, I encourage you to call your local extension office to learn more about some of the demonstrations that we're doing. Next slide, please. Another thing we do is a social marketing program called Quick Wins, where we use a lot of educational materials and marketing posters to promote health messages through a multi-phase marketing program. In 2017, we used marketing messages and educational materials at more than 60 sites serving low-income families. We go to senior citizen centers, to schools, to faith-based communities, and we offer these messages through Quick Wins so that they're visible across Tennessee. And in some locations, we also had roadside signs and billboards. I was looking for that word, billboards, that you might have noticed. Next slide, please. And then we have another program called Tasty Days, which we use fruit and vegetable tastings because, as you know, some children don't have the chance to taste different fruits and vegetables. So we hope that we can encourage them to eat these foods by offering them tastings. There's marketing materials and school engagement. And again, this is a multi-level intervention that involves the school community and promotes the importance and tastiness of fruits and vegetables. We do morning announcements, posters, newsletters, and in-class activities to help students learn fun and interesting facts about fruits and vegetables. And this one here is about spinach, so you can kind of get an idea of what those look like. Okay, next slide, please. So this is a map of the state of Tennessee, and we color-coded these little markers to show you these programs that I just talked about, where we are across the state. Each county coalition determines what programs they offer in their community. So not every county is going to have every program, as you can see, and it also can change from year to year. Next slide, please. If you have any questions about any of the programming we do with SNAP Ed or in Extension in general, you're welcome to call me or email me. I have the address. And Chris Sneed is the director of our SNAP Ed program. He's also open to any suggestions or questions you might have. It's always good to visit or talk with your local county extension office. In fact, many of you, maybe that's how if you've had contact with Extension, that's probably how you've made contact, is through your local county agent's office. And their door is always open, and they always do want to hear from partners. And I believe that's it. So I'll turn it over to the next speaker. Oh, one more thing. I'm going to put in the chat box the website or let's see, I'll type it in. It's called uthealthyfamilies.org, and I'll put that in the chat box for you who want to visit our website. It's a brand new site that's got a lot of resources on it. So thank you.
Thank you, Janie, for all the information. Now you all have figured out some information about SNAP education and what UT Extension does. And I do want to note that TSU, Tennessee State University, also has SNAP education through their co-op extension program, because UT Extension itself and Tennessee State University are both land grant universities. So that's kind of how it all came about, through the land grant universities, and how UT and other universities have taken role on this work. But without further ado, I'm going to now let Amy Cohn, who is again the field program manager for Tennessee for the ARP Foundation, and she'll be speaking to you all specifically about Fresh Savings and Fresh Savings RX and all those programs, and how it relates to her work and what their solution and what they're working towards. So without further ado, Amy, here you are.
Hi, welcome to our awesome training. Thanks, Cassandra. Thanks, Janie. Next slide. Great, thanks. I'm super happy to be here with you all, and honored to present to you all about Fresh Savings and Fresh Savings RX. Before I get into those, I thought I'd just show you this very wordy and complicated slide. Be sure to read every word, please. But this talks about AARP Foundation's transformative solutions, and as it's related to our food security team, which is the team that I have the pleasure of serving all. One of the most important things that I wanted to point out is that we're really trying to transform the food supply system, which is a very daunting and lofty goal, and that's kind of how we roll. We like to just take on big goals and do our absolute best. The Fresh Savings and Fresh Savings RX program really fits in, especially with elevating new and transformational solutions, which is on the right there. We're just working to convene experts within the food supply chain so that we can work to develop new pathways and market-driven solutions, and that's why we decided to apply for this Finney grant to run these programs. Next slide. Look at that. I had a star there all along. Go ahead to the next slide. Thank you. This, as Cassandra and Janie both have pointed out, the issue of hunger and food insecurity is super, super, super important, especially in Tennessee and especially with the older adults, which is obviously the strongest focus for AARP Foundation. And this kind of highlights some of the feedback that we get from the older adults we talk to. It's, you know, oftentimes they're worrying, you know, they may not be hungry right now and they may have all their meals right now, but they're worrying about being hungry and worrying where their next meal will come from. And as most of you know, they're having to choose between groceries or medicine or rent or utilities, or they're having to choose unhealthy foods that have a long shelf life because more perishable shoes sorry, I'm not feeling well today, so if I stumble over, that's kind of the reason. Good thing we're on a teleconference, right? And then oftentimes, even though they're working to stretch their dollars, that it's still just not quite enough. Next slide, please. So the goals of Fresh Savings and Fresh Savings RX, which we've been running now for almost 4 years, is really to increase the purchase and consumption of fresh fruits and vegetables. Oh, we went a little too far. That's okay. Fresh fruits and vegetables by SNAP households. And we were working really hard to try to come up with a program for redemption that could be sustainable and especially scalable, scalable to other cities and states. Go ahead. Next slide. Thank you. These are some of our program partners. Our program partners is, the list is vast and there's no way we could get them all on one slide, but these are like some of the main partners. USDA, we actually are partnered with Tennessee Justice Center. They're working with some things related to these programs for us. Sort of our most important partners that are operating the program are Kroger, and then a lot of farmers markets, produce stands, and locally owned grocery stores in both Mississippi and Tennessee. We also run the Fresh Savings RX in several clinics. Next slide, please. And I think we have some of our great partners from DHS on the call, and I should have highlighted DHS from the other slide, but DHS is a key partner on this program for us. I think maybe do one more click, Cassandra, and it'll bring up a little bit. That's good, thanks. It's basically 3 programs that we're running. The first is in Kroger grocery stores. They're the national grocery store chain we partnered with to pilot this program. It's a coupon-based model, and we are in 25 stores in Mississippi and Tennessee. 16 of those stores are actually located in Tennessee, and they're almost all of them within the Memphis area. We've had over 150,000 coupons redeemed, and the average discount that people are getting is around $6.11 with a maximum of $10 per coupon. Next slide. Thank you. The other program that we're running is at farmers markets. Primarily at farmers markets, we added in some locally owned grocery stores and produce stands in Mississippi in year 2 and 3. It's a token model. It's a wooden token that people get when they purchase SNAP eligible items at those markets or grocery stores. And it's essentially kind of a double up. So when they spend up to $20 on SNAP eligible food, they'll get the same amount in tokens. The tokens can be spent on any fresh fruits and vegetables, and they're transferable between any location that offers fresh savings. In Tennessee, we have 30 locations. Most of those are farmers markets. We've worked with several locally owned grocery stores and a few kind of hybrid models, like farm to table type stores. We've had over 22,000 customers use Fresh Savings in the last 3.5 years, and over 4,800 of them were brand new customers, meaning that they had never shopped with their SNAP card at a farmer's market before. And we've redeemed over $200,000 worth of tokens. Next slide, please. The third program that we're running is a pilot program we started earlier this year. It's called Fresh Savings RX, and it's kind of an overlay, but operates slightly different from the regular program of Fresh Savings. We are testing this in 3 clinics in Tennessee and 3 in Mississippi. The clinics in Tennessee are all located in Memphis. These are given by healthcare providers to patients who are participating in SNAP and who have or are at risk for a diet-related disease. And each patient can get a voucher booklet per visit. Each voucher booklet has 6 $10 vouchers in it. So it's $60 worth of money that can be spent on fresh fruits and vegetables at any Fresh Savings location. So they could use those vouchers at participating Kroger stores or participating local grocers and farmers markets. A little data on that's not on this slide. We have been receiving some health outcomes data from the from the clinics, and it's all looking pretty promising right now. That's very exciting. We've had over 900 patients that have participated, and we have over a 50% redemption rate for those vouchers, which 50% was our goal. So we feel really good about this program, even though it's in the early stages. Next slide, please. So this is our footprint. I love maps, and I love that Janie and Cassandra both had maps. This is a footprint just to kind of show you where we are. So I kind of refer to the program sometimes as a statewide program, but we are in 16 counties. And as you all know, we have, I think, it's like a gazillion counties in Tennessee. I think it's 195 or something like that. And so we're in 16 counties. You can see the grocery stores are concentrated in the western region, and that is a decision that Kroger made. They had to run it under one of their divisions that intersected with Mississippi. Our farmers markets are scattered throughout the state, and then our locally owned grocery stores. We've got one in Clarksville that we've had been partnering with, and then one in Knoxville as well. Next slide. I thought this was kind of interesting, and some of you might really appreciate this. This is kind of a landscape scan of farmers markets. So I wanted to point up a few things. In our state of Tennessee, we have approximately 270 farmers markets. It's hard to land on an exact number because not all of them register, like with USDA. Of those farmers markets, only 18% accept SNAP as form of payment. So that's really low, and that's something that we would love to get up a lot higher. You see in East Tennessee, they're doing a little better. They've got 27% of their farmers markets accept SNAP and EBT. So that's really great, but I think 18% statewide is still a little disappointing. Of the farmers markets that accept SNAP, 35 of them run some kind of SNAP incentive program, and 27 are running Fresh Savings. So Fresh Savings isn't the only SNAP incentive program in the state. It's just the largest right now. Next slide. So we're doing an external evaluation along with this program because we're funded in part by USDA and their FINI program funds. They're also doing a nationwide survey or evaluation of all of the grantees, but we did our own external, and Vanderbilt and TSU are running those, and we've completed it. Now we're drafting it now for publication. So we had over almost 1,300 participants in the baseline survey, and 70% of those did a 6-month follow-up. And what we're trying to identify is the changes in consumers' fresh fruit and vegetable purchases and consumption. So they had a series of questions before they were introduced to the incentive program, and then 6 months again after they were introduced to the Fresh Savings program in their area. We're also measuring impact of a nutritional education program for SNAP shoppers, kind of similar to some of the work that Janie's doing. We have a grocery guide tour that we offer focused on individuals who receive SNAP, and especially those that are over 50. Next slide. I would be remiss without recognizing, because quite a few of our partners are on the call, one of the main successes of this program has been our great relationship in our communities and the support that what we call our community outreach partners have provided these last few years of helping get the word out about Fresh Savings to the community. And so one of my colleagues, I think, is on the call, Victoria Roshke, who helps run the program in East Tennessee. She and I and our other colleague, Brittany, are out in the community a lot at events and meetings and trainings and presentations to get those of you on this call and many others who are so influential in your community, especially among people that are SNAP eligible or also receiving SNAP. You guys have really helped us promote the program, and each year we've seen a very large increase in participation, which has been incredible. Next slide. So I thought this was important. Janie did a great job too, offering a couple quotes from people that she's serving, and these are this is some feedback we've learned and heard. We've got a ton more, of course, but we often hear from people that are first introduced to the program that they literally say, "Are you joking?" or "Are you serious? This can't be true," because especially at a farmer's market, when they're able to double their money, it's a pretty big surprise for them. We've met a man who was really struggling in Chattanooga, had a bunch of kids to feed, and just was like really teetering on feeding his family and paying his rent. And I think he's one of the men that just kind of broke down and got somewhat emotional with our farmers market manager because it made such a difference for his family. It also makes a big difference for the what we call vendors or the farmers, because the money goes directly to them. They're the ones that actually get to essentially double their sales because they're getting more revenue at the markets. And then especially the small grocery stores, they have such a thin margin. So for them to be able to sell more produce and not have to, give it away or throw it away when it goes bad is a huge blessing. I think that's maybe our last slide.
Yes, it is.
Yeah, so I just want to thank Cassandra for allowing me to be a part of this, and Jamie as well. And I'll just mention one thing. Here are the cities. A lot of our farmers markets have closed for the season. As you know, many of them are seasonal. But here are the cities that have still either like a farmers market or something similar operating fresh savings. So if you're in any of these cities and you want some updated information from us, you might already have things, but please feel free to email me. We've still got active locations through the winter in Memphis, Jackson, Nashville, Chattanooga, Knoxville, Oak Ridge, Jonesboro, and Maynardsville.
Thank you, Amy, for that information. And again, thank you for Janie and Amy again for being on the call to again inform us about SNAP education and different classes and education opportunities. And again, Amy, expanding access for fresh fruits and veggies for participants, specifically on SNAP in Tennessee, that get access to fresh fruits and veggies. I do see some questions on here, so as I want to just know, everything's about to wrap up. But I do want to say that I will be taking questions at the end. So without further ado, let's figure out how you can help address hunger and health in Tennessee. So I just want to note to you all some different resources that are out there, and then how you maybe could connect it with your work. There's so many ways to connect people to. If you connect people to SNAP, then again you could connect people to more programs, which is such a wonderful opportunity for our population and our Tennesseans. But I do want to note that again from Amy's organization, the ARP Foundation and FRAC have a course, a free course, you all, that is strictly used to address food insecurity among adults. There is continuing education credit is available for people who want to take the course. So all this information I'm about to convey to you will be all available with a hyperlink at the end of the presentation for you to find these courses and everything. But I do want to also note there's a Hunger Vital sign tool, and this is particularly with the Children Health Watch team, and this is an initiative they were able to bring with, again, pediatrics, different people from different sectors of the work of health and nutrition to come up with a food insecurity screening tool. And it's 2 questions that they ask that again is trying to identify specifically families and young children that are in households that are at risk at food insecurity. Again, I have this link at the end of the presentation so you can find this tool, figure out what it looks like and how you can use it in your own work and the little things that you do. Again, how Jane explained, if you want to figure out how you can bring SNAP education programming, you heard about all the wonderful programs that they have, how you can connect it back to your work. Reach out to your local extension specialists. They're all around the counties, and they're somewhere waiting to meet you. So I would not hesitate to reach out to them, whether you're right here in Davis County, whether you're in Hamlin County, Haywood, come on down and find your local extension specialist. I also want to note, if you're just trying to say, I know clients who are just I know they qualify for SNAP, I know they can get in on these programs and figure out more information on how to improve their health outcomes. Just want to note, there are SNAP coordinators across the state at your local food banks who can help apply individuals for SNAP. So reach out to your local food banks and reach out to your local area agencies on aging and disability. Some of them are in your development district offices that can help people apply for SNAP. Plug into them and find ways to get clients access to SNAP. They can come into your office and your place of work and play and do trainings to get people to know about SNAP. They're out here for a resource for you all. Just knock on their door and come to them. And also, about programming. A plethora amount of programming now. You know that if you connect people to SNAP, you can connect them to programs like Amy noted, Fresh Savings or Fresh Savings RX, which are solely dependent on SNAP participation. So if you know about programs that connect, that our people are eligible for, spread the word. Connect people. Connect as much as you can. And if anything, advocate. You know how these programs can affect behaviors, can address the threat of hunger that we have in Tennessee, and how we don't have to have all those red marks, all that shaded red regions in our state. We don't have to have that whole blue region, almost like just a few counties being being white. We have ways to address it. So let's find ways on how we can educate, empower, and help our community. Again, I want to offer the thank yous to anybody who was attending this webinar. For contact information, you have the listed emails. I didn't, of course, if you email any of them, you will most likely get our email, like the signature, not email, but number at the signature line. So again, there's different opportunities to connect. I know all of us will be always amped to have a conversation with you, how to figure out how we can get programming to you in your county. If you're trying to stay connected with the way Tennessee Justice Center is connecting individuals to, to our partners that were on this call, how we work with different agencies to protect, advocate, and communicate and work on behalf of our clients, feel free to contact us. And I'm just going to show you all this slide before I take questions. Like I said, there's different resources right here about food insecurity, hunger, and health that's done by National Agencies for Resources, the Center for Budget and Policy Priorities. There's a RAND report that essentially tells you the impact of health outcomes and hunger for individuals on a national and local scale. Again, there's the screen course, there's state agencies for contact information, and it lists out the farmers markets that you may want to know who have fresh savings in their area. All this information will be accessible to you after the call. After the webinar. So without further ado, we have about like 5 minutes to take some questions. So I'm going to unmute you all, but I do ask immediately, please mute yourself if you are not talking. But I'm going to offer at least like 3 questions from the audience. I do remember, let me see. I know Randy Dawson had a question. So I saw someone else had a question. I just need to find your name again on my database on the thing. But let me unmute you all. And Randy, I saw you have some questions, some multiple questions in the chat on the question box. So if you don't mind just asking your question, and we'll figure out who may be appropriate to answer. So you all should be unmuted. You should unmute now. Let's see. You should unmute.
Cassandra, this is Amy.
Yes.
Randy had typed some questions in, so did Marianne Morse and Luana Broderick, and I have answered those questions because they were related to fresh savings, and then I clicked send to all, so hopefully my answers can be viewed by everybody.
Right, I saw those questions. Also, great. Well, then, I don't know what's wrong with the technology, you all. I'm sorry, but it's not letting me. I press and unmute, and it's saying unmute everybody, but I don't hear any background. So, sadly, since that's my big indicator for you all, I can give you all maybe 1 minute to, if you want to pose a question in the question box. Again, Janie, I, and Amy can see the questions, and maybe we can figure out who would be best to answer. But again, just want to offer the opportunity that you all can directly email us or try to connect with us. And I know we'll be very wanting to share the information we have. So I'll just give it a minute, and then if not, no questions, I'll end the webinar.
There's a question by Amy Wilson. She says, I want to know if I have a farmer's market wanting to sign up, how do I do that? And I'd like if Amy could specify what she's wanting them to sign up for, because there's programs for farmers markets that Janie and her team run. Okay, she said fresh savings. So I'll answer this verbally because it's been asked a few other times. We aren't adding any new locations, farmers markets or Kroger stores. at this time because it's a grant-funded program, and the grant ends in a few months at the end of March 2019. Sorry, I put 2018 on one, but I'm sure y'all figured that out. So it ends in a few months, so we're not adding new locations at this time. But anybody that thinks that if they know of a farmer's market in their area that they think would be interested in this, feel free to email me at akone@aarp.org with your information and as much information for like a contact person at the farmer's market, because we're collecting interested farmer's markets in counties, and we'll have those pulled together. So whether it's the ARP Foundation or another entity that might want to carry on this torch beyond the grant, we'll know who to contact. So please feel free to do that, and we'll be good stewards of that information. But I will let you know that if your farmer's market is interested in a SNAP incentive program like Fresh Savings, they have to already be taking SNAP, or they would need to start making an application for accepting SNAP pretty soon. So that's the caveat to run a SNAP incentive program like Fresh Savings. Your market has to accept SNAP and EBT as a form of payment.
Thank you for that information, Amy. And just to wrap things up, again, like I said, we are all, again, offering our expertise. And again, here's our emails. If you would like to just know more and connect more with Janie, Amy, or me, again, I don't mind connecting you all through email or how conversations may need to be taken. And again, if you just want to stay in the know of what different nutrition programs that Tennessee Justice Center is working towards to help, again, make sure that everyone can lead healthier lives without having the risk of hunger. Just again, you may again follow us on Facebook, Twitter. We're on Instagram, and then on the last slide, I have our hyperlink to our Hunger Solutions webpage on our website. But without further ado, again, thank you all for attending our webinar on addressing health and hunger in Tennessee with SNAP, and look forward to more learning more about SNAP and the different policies, the different access and different eligibility things in relation to SNAP in our next webinars in January and February. But thank you for attending, and hope to see you on the webinar soon. Thank you.